Good morning to you and to everybody that makes this broadcast possible, and to all those who tune in here in Cuba and also who tune in from abroad. We begin our briefing today conveying our condolences to a Cuban family and friends because of the death yesterday of one patient. We're talking about a 77-year-old female Cuban patient with a history of high blood pressure, diabetes, chronic renal insufficiency, and she was being treated with dialysis. And she had been initially admitted with a cerebrovascular hemorrhagic disease. After 12 days of evolution and 2 days at the ICU, she developed a host of complications, and it was necessary to place a pacemaker on her, and yesterday she died. We regret this loss and reiterate our condolences to her family and friends. As of this date, 1,986 patients are admitted in our country's hospitals, 19 in surveillance, suspects 1,380, and 587 confirmed. 5,264 people are under observation by the primary healthcare system. Yesterday, 1,946 samples were processed to detect the presence of the SARS-CoV-2 and the COVID-19 disease. At the Pedro Curie Institute of Tropical Medicine, IPK, 942. At the Molecular Biology Laboratory of Villa Clara, 425. In Santiago de Cuba, 188. In Havana, 169. In the Brother Almejiras Hospital Laboratory, 129. And at the Genetic Engineering and Biotechnology Center Laboratory, 94 patients. As a result of the analysis of these 1,946 samples, 12 people tested positive to the SARS-CoV-2 virus. This represents 0.6% of the people studied. As you may notice, these are fewer cases than the numbers that we've been reporting in recent days. In fact, it's the lowest number we have had over the last 15 or 21 days of confirmed cases. Hence, in our country, the cumulative total of cases studied stands at 63,560, and of them, 1,741, that is 2.7%, have tested positive. The 12 cases confirmed yesterday were Cuban, 10 were contacts of confirmed cases, bringing to 1,488 the number of confirmed cases in Cuba who have as a source of infection cases previously diagnosed with COVID-19. And here we always reiterate the importance of the epidemiological history and how useful it is that the people who test positive provide the largest number of people they have been in contact with over the last 14 days in order to investigate those people who usually become the source of the highest detection of people carrying the virus in our country. Yesterday, in 2 cases, the source of infection could not be identified, And to date, the country accumulates 83 people, that is 4.8%, whose source of infection remains unknown. Among the confirmed cases yesterday, none of them had a source of infection overseas. So 129 people have reported this kind of incidents for a 7.4% of confirmed cases. These are the people who have been abroad, and once they are back in the country and after a period of incubation, they test positive to the disease. Of the 12 new cases, 5 are female and 7 are male. That is 58.3%. And 51.4% of diagnosed cases in our country are male. Of all cases reported yesterday, 70%, and notice how this indicator grows every day. 9 of the 12 cases were asymptomatic. And we always reiterate the importance of protection when we go out of our homes. We have to make sure that the outing is necessary. We have to bear in mind that the number of people infected that spread the disease in the community is unknown because they show no symptoms of the disease. Of the cases confirmed yesterday, the age groups more affected were those from 40 to 60 years of age, with 6 cases, followed by 2 reported in the group of 60 years and above. They total 8 of the 12 confirmed cases. The provinces with the highest number of cases are Havana with 4 cases, that's 33.3%, Villa Clara with 3, and Ciego de Ávila with 2. That's the distribution of the confirmed cases.
Son 2 del municipio de Arroyo Naranjo, 1 del municipio San Miguel del Padrón y 1 de Centro Habana. En Matanzas se confirma un caso del municipio Cárdenas, en Villa Clara se confirman 3 casos, 2 del municipio Santa Clara y 1 de Corralillo.
Of the 1,741 patients diagnosed with the disease in our country, 579 have a stable clinical evolution. This represents 98.6% of the active cases we have today. This estimate covers all diagnosed cases who remain admitted to our hospitals. These exclude those who have been discharged, the people who have died, and the 2 evacuees. 98.6% of those people admitted diagnosed with COVID-19 are showing a stable clinical evolution. We regrettably lost 1 person yesterday, so that adds up to 74 deaths. This represents a lethality rate of 4.2%. It must be said that the region of Americas is reporting today a lethality of 5.9%, and 13 countries have a lethality rate higher than the average of the region of 5.9%. And we're seeing high death tolls in Canada, Brazil, in some Caribbean islands, in the United States, and Mexico. One hears every day about the high number of deaths being reported in these countries.
en algunas islas
We
del
have the two
Caribe,
evacuees,
en Estados Unidos,
and there have already been
son cifras que dan cuando
1,078
las
discharges,
notificaciones que se dan,
47 of them
pues diariamente se
yesterday.
producen un número importante de casos.
For sixth consecutive day, the number of discharges
Dos fueron evacuados
is
y
higher
1,078
than the number
personas
of people
ya fueron
being
dadas de
admitted.
alta en nuestro país. En el día de ayer, 47
And this
personas
balance
fueron dadas de alta.
shows
Ya ustedes ven que por sexto día
how the curve
consecutivo
is being flattened. Let me give you the data of the discharges by province.
es superior al número de personas 37 de Ciego de Ávila.
We can say that of the 1,078 discharges that have accumulated to date,
12 de Granma,
34 are from Final del Rio,
de Santiago de
28
Cuba,
from Artemisa,
11 de Guantánamo y 14
and 28 from Havana, which is the one with the highest number of discharges,
es un número importante.
because it is also the one with the highest number of confirmed cases. Havana has 426 discharges, 21 from Mayabeque, 78 from Matanzas, 163 from Villa Clara, 11 from Cienfuegos, 56 from Sanchez Spiritus, 77 from Ciego de Ávila, 33 from Camagüey, 8 from Las Tunas, 71 from Honguin, 12 from Granma, 35 from Santiago de Cuba, 11 from Guantánamo, and 14 from the special municipality of the Isle of Youth.
Pacientes
As you can see, there is a significant number of people who have already been discharged from our hospitals. They are in the recovery phase
son los tres
with limited or restricted movement in their homes,
en el hospital
and some have already joined their normal work activities and their daily
La
lives.
Habana, uno en el hospital Dr. Luis Díaz Soto y uno en el hospital Fran País. De los tres graves,
Today we have to report that 8 patients are in critical,
uno en Holguín, en el hospital militar,
they are in critical or serious condition. 5 are in critical and 3 are in serious condition, the same number as yesterday.
se incorpora, como ustedes se dan cuenta, un paciente al reporte de crítico en el hospital Fran País de aquí de La Habana. Desde el punto de vista del movimiento migratorio que en el día se produjo ayer se entraron en nuestro país 147 viajeros cubanos,
Turning now to the migratory flow, yesterday,
de ellos residentes,
147 travelers entered our country.
6 tripulantes, 4 extranjeros por aspectos oficiales,
143 are Cuban residents, 26 crew members,
Canadá, Rusia,
4
China y Haití.
foreigners on official missions, and the flights came from Venezuela, Canada, Russia, China, and Haiti.
En vuelo hacia Venezuela,
Likewise,
y Estados
402 passengers left the country, among them Cubans who reside in the country, going out in the fulfillment of various activities in flights bound to Venezuela, Canada, and the United States. Thus, in Cuba, there are 6,527 immigrants
cifra muy similar
and 4,268 foreigners, for a total of 10,795 visitors, similar number as the one reported yesterday.
y se mantiene el
We report almost the same number of foreigners staying in rental houses,
de La Habana
948 staying in the same municipalities of Santiago de Cuba, Plaza, Centro Habana, and Playa here in Havana,
no,
with the largest number of foreigners staying in rental houses.
104 países con casos confirmados de COVID-19.
From the international point of view, as of May 7, 184 countries remain reporting confirmed cases of COVID-19, with 3,713,730 confirmed cases. We're talking about 89,993 people in one day in the world. And what still is very alarming is that despite the time of evolution of this pandemic, And this is something the director of the World Health Organization and other international agencies have warned about, is that this is a pandemic that is not showing any sign of reduction, as it was expected would be happening at this time. Although it's true that not all countries, and I believe our television keeps us very well informed about this, not all countries have adopted the restriction measures with the same rigor as, for example, those adopted by China at the outset of the pandemic, and which, of course, it helped to bring the pandemic under control in the countries where they had been applied. These 6,000 deaths in the world yesterday gives a total of 263,208 deaths, which gives a lethality of 7.09%. In the Americas, with 1,595,437 confirmed cases, we are talking about 41,592 cases confirmed in a single day. That amounts to 42.96% of the confirmed cases in the world. And yesterday, 3,556 deaths for a cumulative total of 94,122 deaths. And this gives a lethality greater than the one that was reported yesterday, which is just 5.09%. We can only say that the specific lethality rate in our country, as we have already said, Cuba has a lethality of 4.02%. Now, the positive rate of the provinces of our country, that is the positive rate per 100,000 inhabitants. In our country, it is of 15.5 cases per 100,000 inhabitants. The special municipality of the Isle of Youth remains in the first place with 50.4, Havana with 38.7, Villa Clara with 26.9, Ciego de Ávila with 20.4, Matanzas 17.8, Sanchez Spiritus 14.4, Mayabeque 12.5, Holguín 9, Pinar del Río 8.6, Artemisa 6.2, Cienfuegos 5.9, Camagüey 5.2, and Santiago de Cuba, Guantánamo, Las Tunas are reporting a positive rate below 5. As I have explained on other occasions, the rate allows you to remove the effect of the population, which is not the same when talking about cases in absolute numbers, and the rate explains the risk for each of the territories.